be taking this webinar live momentarily. Hello, thank you for joining us. We see that attendees are still joining this conference room. We'll be taking the webinar live in just a moment. Hello, everyone. Thank you for joining us. We are still being joined by attendees. As we've now opened up this conference room, and we'll be taking the webinar live in just a moment. Good afternoon, everyone, and thank you for joining us. Welcome to the Prevents 101 webinar today. We're going to be hearing some very important information from a number of prominent speakers. Thank you for making the effort to be with us. I'm Ilario Pantano. I'm a former State Director of Veterans Affairs from North Carolina and a former Marine that has lost a number of my colleagues to suicide. So this effort is very important to us here at the IVMF and to all of you from around the country. We're so grateful that you joined us. Today, I'm just going to review the agenda very quickly and introduce my boss at the IVMF, Chief Operating Officer Maureen Casey. Our agenda today, first, we're going to have some introductory remarks on the IVMF. Then we are going to have the honor of hearing a little bit more about the work being done with Prevents from Dr. Barbara Van Dalen. We're going to have the opportunity to listen to Cicely McElwain to speak a little bit to us about SAMHSA and their efforts. And then finally, we're going to hear a little bit from Dr. Nick Armstrong as he moderates a panel of some of the questions that have been presented to us. And so with that, Lindsay, can we advance the slides? Terrific. We've covered the agenda. I'm going to go ahead and introduce Maureen Casey. Maureen is responsible for all aspects of the Institute's daily operations, personnel, and financial activities. She brings more than 25 years of public and private sector experience to her current leadership role. And prior to joining the IVMF, she led JP Morgan Chase's efforts to develop and implement a comprehensive firm-wide strategy of assisting members of the military, veterans, and their families. Before joining JP Morgan Chase, Maureen was the Senior Vice President of global consulting firm Giuliani Partners from 1997 to 2002. She was employed with the New York City Police Department, initially as counsel to the first Deputy Commissioner, and then as NYPD's Deputy Commissioner for Policy and Planning. Very pleased to introduce to you Maureen Casey. Maureen, take it away.
Thanks so much, Ilario. Good afternoon, everyone. I'm honored to welcome all of you to today's webinar. The IVMF at Syracuse University is very excited and proud to partner with Dr. Van Dalen and the Prevents team on their mandate to tackle the national crisis of veteran suicide. It is indisputable. The numbers are completely unacceptable and therefore requires an all-hands-on-deck approach for urgent action. I'm pleased to say that action has begun. The President's executive order last year, now the Prevents roadmap, which you will hear more about in a moment, and then significant steps in the right direction. And then we have the compromises reached this week in Washington, D.C. between the House and Senate on veteran suicide prevention bills, and today's discussion with all of you. More steps moving us in the right direction to address this compelling challenge. On the screen, you will see some background information that might help to frame today's discussion. Particularly the third bullet, that more veterans have died by suicide than in the wars of Vietnam, Iraq, and Afghanistan. Tragic and outrageous. At the IVMF, we are singularly focused on positioning those who have worn our nation's uniform and their families to thrive post-service. And that is why this partnership with the task force is so meaningful to us. We are aligned in mission and in how we accomplish it. For example, the roadmap speaks to the importance of a nationwide community-based approach and robust community engagement. We do this through our America Serves program. It speaks to the importance of data and how it informs our decision-making. Our research and analytics organization is second to none. It speaks to the significance of building partnerships, working with others to leverage their strengths. The roadmap calls it a strengths-based perspective. We call it putting resources to their first best use. And it focuses on prevention. And yes, suicide is preventable, but it requires more than intervention at a point of crisis. It's complex and demands a comprehensive response. And as we work hard every day to position veterans to thrive post-service, It is our hope that in so doing, we are able to reduce the risk of suicide. And finally, the roadmap makes communication a priority. It speaks to the need to reach every community and every corner of the nation. That is why we are here with you today. Before we move forward in the agenda, I did want to take a moment to share with you a bit more about the IVMF.
What defines the story of a military service member?
I'm strong. I'm courageous. I'm disciplined. I'm resilient. Why is it now I feel invisible?
There's one mission we don't realize might be their hardest: returning to a life after service. It's then they must figure out how to jump back into a world that is carried on while they were away from families, away from friends, away from community. Making the transition can be a challenge when it shouldn't be. The thing is, those who've served in the military return with valuable skills, unique experiences, and a desire to put them to work in service to others. But desire alone is not enough. Now it's our turn to welcome them to communities, to schools, to careers. To celebrate and recognize their valuable skills and life experiences that make us all better, belonging, thriving, leading. Syracuse University's Institute for Veterans and Military Families believes this is more than our moral obligation. It's an opportunity. IVMF's programs and research work to open doors, lead the way, and aid in transition to a successful, impactful life after service. Join the enduring commitment of Syracuse University and the tens of thousands of veterans in the ivmf family by connecting those feeling disconnected after service. It's time to recognize our part in their story. Let's do more, better, together.
And this next slide shows our scale and our impact. While based at Syracuse University, our work is in communities and on installations across the country, because that is where those we serve are. This webinar is the first in a series. Yes, a total of 3. This work is that important because those we serve are that important. While we can never repay the debt for their service, we can ensure that they have access to the care and services that they need. This is just the first step we are taking to do that. More, better, together. You will be receiving more information in the near future on these upcoming events. And now it is my honor and my pleasure to introduce to you the Executive Director of the Prevents Task Force, Dr. Barbara Van Dalen. On March 5, 2019, President Trump signed Executive Order 13861, entitled The President's Roadmap to Empower Veterans and End a National Tragedy of Veteran Suicide. The executive order created a dedicated task force to coordinate efforts across government to build a national strategy focused on improving overall mental health to prevent suicide. To lead this multi-agency national effort, Dr. Van Dalen was selected as Executive Director of the Prevents Task Force. Named to Time Magazine's 2012 list of the 100 most influential people in the world, Dr. Van Dalen is the founder of Give an Hour, a national nonprofit that provides free mental health care to those in need, including service members, veterans, and their families, an organization she led as president until 2019. Dr. Van Dalen also founded the Campaign to Change Direction, a global initiative focused on changing the culture of mental health. Change Direction is a public health approach that encourages everyone to learn the 5 signs of emotional suffering that signal someone they know may be suffering emotionally and may need help. A licensed clinical psychologist who practiced in the Washington, D.C. area for over 20 years, she received her PhD in clinical psychology from the University of Maryland. Dr. Van Dalen is an expert on the psychological impact of war and a thought leader in mobilizing constituencies to create large systems change. And she's widely recognized for her work in changing the culture within mental health. Dr. Van Dalen has been a regular contributor to the Huffington Post and Time, among others, and has been interviewed by major media outlets too numerous to mention here. Importantly for this crowd, her father was a World War II Navy veteran. All of this to say, she is the right person to lead this effort, and it is my pleasure to introduce you to Dr. Van Dalen.
Thank you, Maureen. That was very gracious, and we are thrilled to be here working with IVMF, and it's lovely for me personally to be working with IVMF in my new role. It's not so much new anymore. It's been a little over a year, about 15 months since I stepped into this position. But through my work with Givenhour, we worked together. And so it's a continuation of this important work. I want to thank also Cicely for joining this conversation today, because this is, as we'll talk more about going forward, this is an all-of-government, all-of-nation approach. And SAMHSA and HHS, huge partners and members of HHS is a member of the task force. So I am ready to go forward and tell the audience about what we're doing and how we're doing it. Very good. Okay, so as you heard from Maureen, this office that I now lead is the result of an executive order that was created in March of 2019. We've often been asked, how is this different, or why is this different? And PREVENTS, the acronym, stands for the President's Roadmap to Empower Veterans and End a National Tragedy of Suicide. And this is the first ever all-of-nation, all-of-government, public health-focused approach to address any major mental health challenge, let alone suicide. The PREVENTS Roadmap was created with one mission in mind: to end the national tragedy of suicide for veterans and all Americans. And that sentence is really important, and I'll keep coming back to it. We can't end the tragedy of suicide among our veterans if we don't change the entire culture. Our veterans are everywhere. They're in our neighborhoods, in workplaces, in our schools, in our families. And if the culture around them does not support some of the things that we are pushing and promoting and encouraging and engaging everyone about how to address, how to prevent suicide, we'll never get there. So as we talk through, it should be clear that some elements of the PREVENTS work is focused on all of nation, everyone. Some specific programs or some areas of research dive down and work specifically to address this issue with and among veterans, service members, military families, which is why great partnerships like IVMF are so critical. This mission is complex and audacious, but it is achievable. Suicide is preventable. That doesn't mean that each suicide that has occurred was preventable. We don't ever want to think survivors. We don't ever want to imply that survivors, someone who lost a loved one to suicide, could have or should have done something different. What we're saying is, if we do the work, if we change the culture, if we make it easier to access services, if there's more coordination, if we increase the literacy of all Americans about the issues, the risk factors, the protective factors that lead to suicide, we will prevent suicide. With the launch of PREVENTS, we are telling the nation that we can prevent suicide by changing the culture around mental health. As you heard, it's something I've been working on for a very long time, and we're making huge strides. We emphasize the importance of collaboration. We cannot do this alone. We as an organization, even as an all-of-government approach, we need to partner with all of the organizations that are on this webinar, with wonderful efforts like IVMF, of course, with our agency partners. We elevate champions and empower leaders, and you'll see in a few slides some of the champions that we're elevating. But again, this is about identifying those who are doing good work, lifting them up, supporting, helping how and where we can. We want to identify and amplify innovative solutions. One size doesn't fit all. We know that, especially around something that is so complex. Suicide is such a complex phenomenon. One of our partners, one of my friends, who's a researcher in another institution, said once, and I heard it and I thought, that's exactly right. it takes about 30 different things to go wrong simultaneously, you know, a horrible perfect storm, if you will, in order for someone to die by suicide. Some of those factors may be mental health related, but they're not necessarily all mental health related. And it may be that someone who dies by suicide had never had any mental health challenges, never been diagnosed, never was in treatment. So it's a complex phenomenon, which means empowerment. That word in our name, the President's Roadmap to Empower Veterans, is critical because we know that people who feel empowered, people who feel like they have options, choice, a future, are less likely to die by suicide. And then finally, involving everyone, because this is an all-of-nation approach. So this is our strategic framework. You know, when I stepped into government, again, you know, I came from the nonprofit space. Before that, I still am a clinical psychologist, but I was a practicing clinical psychologist. And as I was building Given Hour, you know, I moved into this nonprofit world and learned about that work. But at the core of me, I've learned that I build things and I look at, well, what is the problem and how do we get there? So when I stepped into government, folks love logic models, and logic models are lovely. Logic models typically start with what's the problem, and what are we going to do, and what is the solution? They typically are linear. And so when we sat down with some of our partners and said, okay, we were encouraged to create a logic model of some kind because we were going to create this roadmap, this plan, because that's what this is. It's not a report, it's a plan. So as we looked at logic models, didn't really fit this challenge. This strategic model is much more, this strategic framework is much more what we do day to day, which is at the center, you see prevent suicide. But each ring of these concentric circles going out represent different elements and aspects of the work that we're doing and who we're engaging, what different pieces. So in order to prevent suicide, we need to engage in culture change activities. We need to make sure that our research is focused in ways that collaborative and coordinated. We need to look at policies, how they might either impair progress or maybe they help progress, but we need to look at them and understand them. Communication, state and local action, all of these elements in these first three that lead into suicide. And then the last two rings are my favorite because the second to the last ring has all these individuals because we're all involved. We all have a role to play. We all have influence. And then the final ring on the outside, all of our institutions, faith-based organizations, academic institutions, our government, our communities. Next slide. So the roadmap, which as I said, it is a plan. It is a living, breathing plan. It's like a real roadmap. If I'm from California, so if I was going to go from where I am now, which is right outside of Washington, D.C., and my goal is to get to California, I'm going to set out, I'm going to have a map, a plan. Used to be, you know, we had a paper kind. Now none of us know how to get anywhere because we rely on our little digital assistants. Anyway, if I was setting out on that roadmap, using that roadmap to guide me, I might come across a flooded bridge, or I might come across some barrier that would cause me, that would require that I take a turn, that I change, that I get in more resources because maybe, you know, my car breaks down. This roadmap is built this way. It is constantly being evaluated, studied. That's why we have hundreds of subject matter experts crawling all over it with us all the time. That's why we worked with hundreds of organizations and all of the agencies and did focus groups and brought people to Washington when we could before COVID to build this. And what it resulted in a 60-page document that you can find at va.gov/prevents, and all this information will be made available to you. And this is sort of really the heart and soul of the work that we did. For those who are interested in really going deeper, you can also find on that website a 300-page document, which is the supplemental material that led to creating the roadmap. And it has everything in it, plus 164 recommendations that fit under the 10 overarching recommendations that you'll find in the roadmap. So the roadmap is the heart and soul with these 10 overarching recommendations. The supplemental document gives you all of how we got there, what we did. For example, we put out a request for information and got hundreds and hundreds and hundreds of suggestions, of reports, of studies. So you can learn and find how we did this and how we made the sausage, if you will, and how we got all those agencies to agree to a plan, because that in and of itself is its own story. So each recommendation contains specific agency actions. There are actually 47 agency actions total. Each recommendation falls under one of 4 strategic areas of focus. And you saw that in our strategic model. Communication, huge, and we're going to talk a lot about that. I'm going to show you some very cool tools. Research, we need to understand suicide for humans. We need to specifically understand suicide for veterans, for military families. We need to ensure that all the different groups that are doing this work, and there are many academic institutions, corporations, governments, that we integrate that data, that we identify it first, who's doing what, that we integrate it, that we share it, and most important, that we translate it so that it is available for use in communities, because again, this work happens at the community level. It does not happen from Washington or any other major hub of where it begins or the plan originates. It has to translate into work that people in communities can put to good use. So that's the research. Programs, tons of great programs going on. IVMF is involved in many great programs. And so are many other efforts out there that we know share common denominators, share approaches that work. So how do we pull that all together? How do we make sure that, again, a community that's just getting started has access to that so that they're not reinventing the wheel? So that's a big chunk of our work. And then finally, policies, because policies either help or they interfere with progress. Each one of these could be its own executive order, but because this requires all of these things to be done simultaneously, my office is fortunate. It really is an honor to have the opportunity to do all of these simultaneously. Next slide. So our first priority, the National Public Health Campaign. Our goal was to create and launch a national public health campaign. When we first started work, as we were pulling in all these other pieces that you just saw the elements of, this was front and center, because that's what the executive order calls for, the first ever public health campaign. So that requires a very big, bold campaign. So I'm very excited to share that we launched the public health campaign, the first of its kind ever, a national public health campaign focused on suicide prevention. It's called REACH. We launched it on July 7th. Since the launch of REACH, the campaign has yielded nearly 2 billion impressions, with a B, 2 billion, 5 million visits to our website. Over 5,000 people have taken the Prevents Pledge to REACH. And during September, which is Suicide Prevention Month, we are in the midst of a pledge drive. We want all Americans to take that pledge. It's a simple thing to do, and we would love all of your help in pushing out the pledge. You can find the pledge at our website for the REACH campaign, which is wearewithinreach.net. Again, you'll see all of that. Next slide. This is the logo for REACH. We are all within reach is the tagline. And before I show you the first video that was created to share with the world about the work that we're doing and what we're working on, a little bit about this concept of reach. We wanted a simple message that people would be able to remember. They would know where to go to get information. We wanted a message that really was bi-directional. And that's why we came up with REACH, or how we got to the name for the campaign. There are many sort of pieces of this, but the primary focus is we want to encourage all Americans, one, to reach for help when, if, how they need it early, not waiting until there's a crisis. We can't wait until there's a crisis. We want to reach people early in that process when they're hurting, when they're suffering, when they're struggling, when they're overwhelmed, confused. So a lot of our work is on educating people about risk factors, protective factors, getting rid of the myths that surround suicide. So that's one side, really focusing on the individual, that veteran, that military family, that teenager, that first responder who may be struggling and hurting. As I said earlier, remember, this part of our work is for everyone. REACH is a national public health for everyone. The other side of the REACH message is that we want to encourage all Americans to learn the risk factors, learn the protective factors for people that they love, people that they care about, people that are their friends, their family. We want to educate people so that they know how and when to ask someone, how are you doing really? I've noticed this. Are you okay? I've seen this, or things have changed. Here's what works for me, and find ways to engage people and bring in others to help. We want everyone to be part of the solution. Next slide. So as we moved forward with creating this campaign, we started talking to partners like IVMF and a whole world of organizations and efforts that were coming to us, which has been wonderful, saying, how can we help? And so one of the organizations was PenFed. Some of you may know the PenFed Corporation, and they also have, the credit union has a foundation. So the foundation wanted to help. They brought in another partner, Soldier Strong, which some of you may also know. Those two organizations worked with us as we were building the office, literally as we were bringing in staff and creating the infrastructure to create the first tool that we were able to use to share, to launch REACH. So now we're going to show that for this audience, and then we'll talk a little bit about some of the tools that we've created since then. So why don't we go ahead and show this one.
Wanted the thoughts to stop, the memories to stop, the nightmares to stop.
Right now in our country, too many of our friends, families, and neighbors are suffering and are at risk for suicide. This is especially true for the extraordinary men and women who choose to serve our country.
One night, I just was like, I can't take this anymore.
I felt it was the only way out. I think I not only attempted it once, I probably attempted it like multiple times.
132 Americans a day are losing their lives to suicide. And each suicide is not only an individual tragedy, it also brings severe suffering to the many people attached to the individual who dies. Suicide is a national crisis that touches all of us. First responders, farmers, university students, LGBTQ+, all are confronting high rates of suicide. The COVID-19 crisis is only making a bad situation worse. But this need not be the case. Suicide is preventable.
I didn't want to end it all. I just wanted to end the pain. It was more of a cry for help.
Somebody might look normal, might be normal, but the next thing you know, they're gone because nobody asked them, are you okay? Are you having a bad day? Are you, do you need to talk?
As a nation, we must reach out to those who are suffering. Just the act of reaching out to those in need can help save lives.
What you're going through now isn't always going to be.
Approach somebody about this. Talk to someone. It doesn't have to be a therapist. It doesn't have to be a doctor. It can just be a friend. You need help. Reach out and get it.
We are all within reach. Reach out to someone you know today. And if you are hurting, please reach for help.
Just reach out.
So I've seen that, I don't know how many times, but every time I see it, it touches me. Those were obviously real veterans who are sharing their story to try to reach their brothers and sisters so that they encourage people to reach. So that was the first, and we used that and continue to use it. And these assets, you know, we want them to get out there. So if you have opportunities, you'd like to use them, please reach to us so we can get them to you so that you can make use of them. So that we used to take over YouTube I think last month. Yeah, we're in September now. And that reached 30 million Americans, and it's part of that massive push. And so since that, we've then created a lot of other assets. There are print ads, there are animated ads that you may have seen. I see them regularly. It's really exciting when we do, because it tells me, you know, we're getting the message out there. This next one that you're going to see is the latest short piece that will be pushing out and be seen all over the nation. You know, and before COVID, when we talked about internally about our plan to push this out, you know, we had visions of having the ads on buses and in airports and on billboards and jumbotrons. But things changed, and so a lot of our focus has been on digital and live streaming opportunities and television. So we may eventually also be in airports and buses, but we're going where people are. And as we move into the next phase, these ads and many others will be focused in communities that have high concentration of veterans and high concentration of suicide, and we'll be creating new tools that are specific to some of the risk groups that you saw referenced. We know our veterans, first responders, at-risk youth, Native Americans, farmers, and obviously our veterans are in all of those groups too. Okay, let's show this one. And there's our website. We are within reach. That's going to change soon. Oops. We're excited about the change. I can't share what it is yet, but it's going to make it even easier for people to get to. But it won't matter where you pop in. That website will always direct you to that web address will always direct you to our website. The more we push this out and the more you help us, the more people we will reach. So that's priority 1 for 2020. All of these that I'm going through right now are our 2020 priorities. They all flow from those 10 recommendations that I mentioned. And again, you can find all of this in the actual roadmap itself. So the second priority is to enhance research. So I talked about what our goal. It's to accelerate research, but it's in a way, more importantly, to change how research is coordinated at the federal level, but also with our non-government partners. And so we're looking really to improve our ability to tailor, eventually to tailor interventions, because an intervention that works for a 70-year-old veteran who served during Vietnam is very different, likely very different from a young woman who maybe left the military a few years ago. Perhaps she experienced military sexual trauma. What reaches her and him, and how to intervene and what might be effective. So that's where we're heading. And what we're doing is working with the Office of Science and Technology Policy. They're our government partner in this, developing a comprehensive list of available data sets across government agencies. So we know where's the information and how do we share it. And then developing agency-specific strategies to formulate roles and responsibilities. So pulling, everybody wants to do this work, but without the concerted effort and staff and really agenda, it can't get done because agencies are all doing all the important work they're doing. Next slide. State, local, and community grant programs, huge, huge, huge. And many of you are involved in that area of focus. So we want to leverage existing agency funding priorities to support, prevent state, local, and community grants and prepare for grant implementation. What does that mean? So we want to identify what's out there already and where are there gaps? Where can we eventually bring additional resources, additional support? So we are working on state data implementation plans. How do we track the data from states? Creating a database to track all the ongoing grant opportunities that are focused on veterans, mental health, suicide prevention. So far, we've tracked 140 grant programs that total $2 billion in funding. A lot of funding is out there. Again, it's not always coordinated. And so our work is moving in that direction so that we can determine what additional funding is needed and get it into communities. Next slide. So more on the state and local community integration, activation, and collaboration empowerment. So what this part is about is all that I just said in the prior slide, we're not waiting for that. That's great, it's important, we got teams working on it, but we want to move forward now to gather information and share it, identify best practices, coordinate with our partners, again, like IVMF and others. So we're out on the road now virtually. We were visiting states in person. We visited 5 states before COVID and have now started visiting states virtually. And we'll continue to do that throughout the life of Prevents. I should say, in terms of the life of Prevents, it's a 3-year term for the actual implementation of that executive order. The first year was to build a roadmap, which we did. And now years 2 and 3, we're working on implementing all the recommendations, all the strategies, all the approaches. We also, to this point, just launched in September a veteran survey that runs throughout September. Again, you'll get all this information. You'll have access to it. It's on both of our websites. We want as many veterans as possible to answer that survey. It's short, but it gives us information about how to reach veterans, what's helpful to them. We want their perspective as we implement all of these recommendations. Next slide. State proclamations. So again, everything happens at the community level, so we're working with the states. These are 3 examples of the 43 proclamations that have already been signed. I'm so proud of the team and so pleased with all the governors that have stepped up to sign this. So this is for the states and territories. We want to get them all on board by the end of the year. We're well on the way. And even if we aren't able to get them all to sign, we've already visited some that may not sign for whatever reasons of their own, but my guess is we'll get all but a couple to actually sign this. So hopefully your state's on there. If not, nudge your governor. We had a virtual signing last week with 4 of the governors who came and signed these virtually, and we took pictures, and now we're pushing out and thanking all the states. All of these states have made the commitment to help promote REACH, the campaign you just saw, to work in some coordinated, collaborative way, either through the Governor's Challenge, which you're going to hear more about from Cicely momentarily, or through some other coordinated effort. So again, hopefully you can hear our role is to identify, lift up, coordinate, facilitate. So that's the state proclamation. Next slide. We want champions out there promoting what we're doing. So we created an ambassador program. We have now 21 ambassadors plus a canine ambassador. So in the bottom left, you'll see one of our ambassadors, Bob Kaufman. And with Bob, you see his service dog, Ron. So Ron is our canine ambassador. All of these amazing people are influencers in our nation. Second Lady Karen Pence is our lead ambassador, and she has been amazing. Every event she's at, she talks about prevents, REACH, mental health, suicide prevention. The Surgeon General is one of our ambassadors. Mrs. Milley is one of our ambassadors. There are people from entertainment, from academia, from government, from corporations. It's a great collection. And we also have state ambassadors. So if there are people in your state who you feel could be a great state ambassador for Prevents and REACH, please let us know. We vet them, and make sure they have information to use, to push out, to help at events, through social media, any way that they can champion our efforts. Next slide. Our veterans are everywhere. That's one of the points I made early on. They're in the workplace. And so we partnered with the VA and the Chamber of Commerce to create a pledge, first of all, for employers to say that they too are part of the solution. So the pledge that was originally signed by 30, and then we added another group in August. So far, those organizations total more than 6 million employees. Then we added a guide. So this guide is free, it's available, and it talks about basic things that any corporation can do to improve emotional health and well-being in the workplace. So we'll continue to push this out ongoing, but if you and your community want this, it's free, it's available, it's digital. We can get this out to employers so that they too know how to ensure that in the workplace, we're preventing suicide. Next slide. This year, in 2020, we will launch in partnership with the VA a grand challenge, a grand technology challenge focused on suicide prevention. You may be familiar with these kinds of challenges. They're very cool. Basically, here's the problem. All right, let's pool some funds. And this we will be doing with our government partners as well as non-government organizations, corporations that may want to be part of this solution. Again, so we're inviting everybody to be. But there's a prize, and different teams will submit their proposals. There'll be a whole process, judging, and eventually the solution that we seek, which will be a technology-based solution. It won't be the only solution. Obviously, you've heard all the things we're doing, but it is a piece of, it is a way to improve what we have now, a marketplace to help people who are looking for services, for tools, for tips, for information. So that's launching this year. Next slide. And finally, our 9th priority is professional credentialing and certification. Why? Because you would think, most people would think, that all mental health professionals are knowledgeable about assessing for suicide risk. Not so. When I was in graduate school, I never had a course on it. I wasn't trained. Now, that was a long time ago. But even today, it is not part of curriculum. Many mental health professionals are not trained, let alone physicians, nurses, and then going out from there, other professions that come into contact with our service members, veterans, anyone who might be suicidal. So this project is focused on developing partnerships and creating tools. We know we'll have a couple of these tools already in place by the end of 2020. Next slide. So this is us. These are all of our little, how you find us, our social media. I tweet. That's sort of my social media platform that I use. We are also on Facebook. As I said, you can get to our website by va.gov/prevents, or we are within reach.net. And we also just launched our Instagram. So that's us, and our hashtag is reachnow. Next slide. This is us. There's me. Our communications, senior communications advisor, Karen Nigdell, is on the Zoom webinar today. Liz Barnes, my deputy, is here. Carolyn Colley, our action officer. Any of us, send us a note. If you need something, want a partner, have opportunities, please let us know. We can only do this with your help, but together we will prevent suicide. So now I'm going to turn it back over to Ilario, because I know he's going to introduce my friend and colleague, Cicely, and you're going to hear more about what the great work that SAMHSA is doing in this space.
Thank you, Dr. Van Dalen. I think Cicely is probably a friend of many of the listeners on this call, but that presentation was really wonderful, Doctor. Thank you so much for that. Cicely Burrows-McElwain currently serves as the Military and Veteran Affairs Liaison for the Substance Abuse and Mental Health Services Administration, SAMHSA, where her efforts focus on strengthening cross-agency collaboration between the VA, Department of Health and Human Services, HHS, and the Department of Defense in meeting the behavioral health needs of service members, veterans, and their families. She's got 20 years experience working in rural and behavioral health systems in local, state, and federal systems. And prior to joining SAMHSA, she served as a clinical social worker for the VA in Vision 5. She's also an adjunct lecturer for Salisbury University's social work department, teaching course content with a focus on rural social work and disaster mental health. And with that, my friend Cicely.
Thank you so much, Ilario. Thank you so much, Barbara. And yes, it was exciting to see so many familiar names on the participants list so far today. On behalf of my amazing leadership at SAMHSA, we are honored to be joining this series of webinars in support of Prevents. SAMHSA is one of those many wonderful federal agencies that have been at the table with Barbara's team from the start. And we're so excited because we recognize, as Barbara's own words put this in, this idea that we're able to take and amplify the amazing work going across our nation when it comes to suicide prevention. I'm going to talk very briefly today, but here to support some of these amazing efforts and tell you a little bit about the work that we're doing in partnership with VA and the amazing work that SAMHSA has as far as resources and grants that you could take a peek at with some teasers to go into the next few sessions too. But if you're not familiar with the fact that starting back in 2018, SAMHSA and VA started to partner to do some work with communities around suicide prevention for service members, veterans, and their families, known as the Mayor's and Governor's Challenge efforts. Those efforts really have grown, and if you look at the next slide, you'll see kind of where they've grown over the last 2.5 to 3 years. Our work has actually been able to reach so many of your communities because of the fact there's leadership buy-in at those state levels. So I am not at all surprised that in such a short time, the Prevents team has been able to reach so many governors with the message of the Prevents initiative and getting their buy-in, because we know from the work that we've been doing as well on these initiatives that there's a real commitment. Folks are coming to us and asking around what resources they can put into place at both the local, state, and community levels to really do that public health holistic approach. So we're so excited that now we're up to 27 different teams, states engaged in this process, but really it's a whole nation that's actually started the conversation. And a big part of that comes from the fact that now we have a roadmap that assists us in kind of where to go from here. I love that analogy of when we put that map together, what does it mean? Where do we go? And that idea that folks need to know that that map actually was crafted by many of you because of the holistic approach and the take in creating the roadmap and hearing from so many important voices across our nation as it was created. That work to us means that we need to look at how do we do a better job in supporting and really reaching the goal that SAMHSA has in helping to reduce the impact of suicide, of mental health issues, and suicide and substance use issues across all of our communities in the nation. If we look at the next slide, it's really just critical for folks to know that as a partner in Prevents, SAMHSA brings to this work a number of resources that have been out there for a while, some newer than others, but resources and data resources that really require folks to just take a look at, of that $2 billion that Barbara's team was able to come up with, what does that look like when we're talking specifically about community level interventions and state level interventions, and where to get started. And so I really wanted to encourage folks to take a look at some of the resources specifically that HHS and SAMHSA have to bear. In particular, the resources that are out there. If you have, at the very base level, an individual, start with your own neighborhood. What do we need to do to help those who need help? Findtreatment.gov is an amazing resource where you can find treatment in your own backyard or close by. Our NISDA data, we just had a 2019 report released with our Assistant Secretary, Dr. McCants-Katz, doing a really great slide-by-slide explanation of where things are going when it comes to the mental health impacts in our communities, as well as substance use. You saw the numbers in the Prevents webinar presentation. You saw the numbers that we see that are not going down, unfortunately, for so many of our states. We need to get some action around this, and having that knowledge and understanding of where that data is going is really critical. So I encourage folks to check out the NISDA data. And the biggest question of all that we always get, no matter whether we're doing the Governor's Challenge work or any of the work, is where can we get funding to make a difference for this work? And so I really do encourage folks to take a look at the samhsa.gov/grants webpage We do something where you can sign up for a grants forecast, which means that we'll notify you ahead of time when we have our annual list of grants that are coming out. Sometimes those forecasts happen really quick. For instance, with all of the CARES Act funding and COVID funding that actually brought new state and community level suicide prevention grants into play in the last several months. Being on those grants forecast emails and e-blasts are really critical. And SAMHSA's technical assistance resources will help folks know about those if you sign up for those e-lists. Our work is done through the Service Members, Veterans, and their Technical Assistance Center. If you haven't resourced that yet, please don't hesitate to reach out and see what we can do. In addition to running and offering the National Suicide Prevention Lifeline, Suicide Prevention Resource Center, and an amazing network of regional technical assistance centers. So we're there to help. We are so honored because we know that now more than ever before, with the Prevents leadership in place, we can really make a difference at every level of our communities around suicide prevention, not just for our military and veteran families, but for all families. Thanks so much, Ilario. Back to you.
Cicely, what a pleasure. I know so many in the audience are interested in these resources, and I think they'll also be interested in the questions that we've got fielded now by Dr. Nick Armstrong. He's our Senior Director for Research and Analytics at the IVMF, and he's also adjunct faculty at the Maxwell School of Citizenship and Public Affairs here at Syracuse. Nick leads the Institute's insight function of more than 24 applied social scientists and data scientists, as well as solution engineers, supporting global service delivery to more than 25,000 military-connected individual families annually. He leads a broad portfolio of externally sponsored social and policy research programs and program evaluations. He's led commission studies for organizations such as the U.S. Office of Personnel Management, the IBM Center for Business and Government. But I just also want to conclude with the fact that he's an Army veteran, a West Point graduate, a captain who did more than 3 years in Iraq, Afghanistan, and Bosnia, with 2 Bronze Stars, a Combat Action Badge, and the Ranger tab. And with that, Rangers lead the way. Nick, over to you.
Hey, good afternoon, everybody, and thanks so much, Ilario, for that introduction. You know, I'll just echo my colleagues, Maureen, Ilario, and the whole IVMF team about how personal, how important this issue is, and what a delight it is to be a partner to the overall activity to help raise awareness around this important effort. And so it's my pleasure in our remaining few minutes here just to field a few questions that we actually pulse the audience in advance. And we have a few here in our next slide. You know, the first one, just on the heels of Cicely's presentation, I would like to kick this back to Dr. Van Dalen, just to help talk a little bit about the relationship between the Prevents activities and REACH and the connection to the VA SAMHSA work already underway with the Governor's Challenge in particular. And so with that, Dr. Van Dalen.
Thank you, Nick, and thank you for your passion and your service and your ongoing service to our country doing the work you're doing with IVMF. So I think probably the audience understands that we are in lockstep with SAMHSA. Our office sits between the Department of Veterans Affairs and the White House in terms of we think about structure, where we exist in the federal government. And the task force is made up of all the agencies of the government, HHS, which is where SAMHSA lives. So as you heard, Cicely participated. She was one of our subject matter experts, and we have many others from SAMHSA to actually create the roadmap. And the work we're doing in communities, whenever we go to a state to visit, whenever we're involved with anything to do with the states, we work closely with our colleagues and we ensure that we are meeting with those individuals who are involved in the Governor's Challenge. So it's knitting things even more closely together. SAMHSA already does that work. We're coming in, the VA does that work with SAMHSA, with the Governor's Challenge, and then we're bringing additional opportunities to identify, and maybe if there's something that we do that is secret sauce or is special to that process, because of the high level importance of this work to this administration and just to our nation, we can lift up what we find, what we see, and shine some more light, which brings more attention, more energy, more funders, outside of governments, and work together with our government partners to identify where additional funds could help with this work.
Thank you, Dr. Van Dalen. Cicely, I don't know if you have any comments to add to that.
I think that was a great overview. I mean, the lockstep is right there, and no better audience than to understand how important that is when we march along together. The work is ongoing. There are no prevent states or governor's challenge states. It's just our nation trying to help each other. And we are so honored to have this amazing platform, the foundation being set with the roadmap to be able to help carry this work into the states that we haven't reached yet as well.
Great, thank you. Moving on, next question. Will there be prevents funding available to help states and communities build capacity?
So, oh, do you want me to take that, Nick?
Yes, please.
So as I mentioned when I was doing the presentation, and that's coming from the nonprofit space where I ran a nonprofit for 15 years, funding is so critical because otherwise nonprofits can't do the work they're doing. So the short answer is yes, that is one of the things we want to do, is to help identify and bring additional resources, whether it's funding that specifically comes out of the prevents effort. We did create, as part of the mandate, a proposal, which is meant to be, if you will, sort of the gold standard. And again, we work with all of our government partners to create it. What does work in the communities? What does it need to look like? And I will say that one of the things that we definitely are looking to support is collaborative, coordinated efforts, period. No one organization, no matter how amazing they are, can do it alone. And so the collaboration and coordination, which is at the heart and soul of the Governor's and Mayor's Challenge approach. So this first chunk of work we're doing is identifying what's out there. And while we're doing that, looking, could there be some funding that maybe is over here that could be directed in this way? Are there foundations that are interested in funding community-based efforts that we can direct and move in that lane, with the eventual plan of, yes, identifying and bringing additional funds into communities that are doing this critical work.
Thank you. So given the time, I would just actually like to end on the third question, and possibly the most important question of all, and actually turn it over to you, Dr. Van Dalen, to close out with some final comments. But what should I do if someone tells me they are thinking about suicide?
It's such an important question. Yes, it is the most important question. And this goes to the heart and soul of what we're trying to do when we reach people and educate them. Of course, you take a comment about suicide seriously. Don't be afraid to ask follow-up questions like, tell me more about that. What is causing you to feel that way or think that way? Try to help the person articulate, how deep is this wound? How serious are they? We have the National Suicide Prevention Lifeline, which everyone should know the phone number. It's 1-800-273-8255. That's one if you're a veteran or service member. If you want to call that, you don't need to be in crisis. You can call to get information about how to talk to someone with some specific tips that may be relevant to the conversation that you're currently having with someone. If you're talking to someone about this, you can also find out, are they in treatment? Are they connected to the VA? Are they thinking about what things that could help them, but they don't have the resources, or they're afraid to share? You being part of that conversation, being willing to go on that journey, as scary as it might be for you and for them, is critical. Just the act of reaching to someone, just the act of being willing to listen could help save someone's life. We have more resources on our website. SAMHSA, obviously, there are resources there. How do you have those conversations? Last thing I'll say is, if you are worried about someone, also don't be afraid to bring in additional help. If you think it's imminent danger, call the authorities. It's okay if the person's angry at you after the fact. You're saving their life. It's okay. They'll get over being angry at you. But don't be reluctant. Trust yourself. If you're worried about someone, take action. And then I know we're out of time, so I just want to thank ivmf and SAMHSA information out. I look forward to working with all the agencies and organizations that have joined us. Look forward to having you join us for the next two ongoing in this series. And thank you all for the good work you're doing. And remember, together we will prevent suicide.
Thank you, Dr. Van Dalen. Thank you for all of you that joined. If there are more questions, we'll be responding to everything that's come up in the chat and in the Q&A session. And please, if you haven't already, register for 201 and 301. There'll be more value as we take a deeper dive in these very important topics. And please, likewise, share this information with colleagues. While it's terrific that we had over 100 participants, it's also more important that we achieve 200 to 300 next time. So please share this information. And again, thank you for joining us.